Surgery: for early-stage mesothelioma located only in the lining of the lung, surgery may offer the best chance of extending a person's life. The main type of surgery for pleural mesothelioma is called extrapleural pneumonectomy, EPP. In EPP, the surgeon removes one entire lung, the lining of the lung cavity, pleura, the hemidiaphragm on the same side as the lung removal, and layers of muscle in the chest wall. Lymph nodes near the tumor are also often removed for analysis. EPP aims to remove all visible traces of the cancer, but it is a major operation that can have significant risks and side effects. Some potential complications include lung collapse, infections, bleeding, nerve damage, fluid buildup after surgery, and life-threatening problems with heart and lung functions. Most patients will need to spend time recovering in the intensive care unit after EPP. Overall survival rates after EPP alone are disappointing, with most people experiencing recurrence within 2 years. As a result, EPP is now usually recommended only as part of a multimodality therapy approach that combines surgery with other treatments. Chemotherapy. Chemotherapy uses anti-cancer drugs that are administered intravenously or by mouth. The drugs travel through the bloodstream to reach and destroy cancer cells throughout the body. For mesothelioma, chemotherapy may be used neoadjuvantly, before surgery, to try to shrink a tumor or make it resectable. It can also be used adjuvantly, after surgery, to kill any remaining microscopic cancer cells. Standard chemotherapy regimens for pleural mesothelioma often combine a platinum-based drug like cisplatin or carboplatin with another chemotherapy medication such as pemetrexed, Alimta. The side effects of chemotherapy depend on the specific drugs, dosage, and the individual patient but may include hair loss, nausea, vomiting, diarrhea, mouth sores, bone marrow suppression, decreased red or white blood cells or platelets, fatigue, neuropathy, risk of infection, and others. Often these side effects are manageable with medications and get better after chemotherapy is complete. Research shows that pleural mesothelioma patients who receive chemotherapy after surgery generally live longer than those who have surgery alone. Radiation therapy. Radiation uses high-energy X-rays or other particles to destroy cancer cells and shrink tumors. For pleural mesothelioma, radiation therapy may be used after surgery to further eliminate microscopic cancer cells at the original tumor site. It can also be used palliatively, to relieve symptoms but not cure, for mesothelioma that has recurred after previous treatment or has spread to other areas. Common radiation therapy techniques for pleural mesothelioma include intensity-modulated radiation therapy, IMRT, and proton therapy. Radiation side effects depend on the area being treated but often include skin redness and irritation, nausea, fatigue, lung damage like pneumonitis if radiation is delivered to the chest area. Most side effects disappear over time after treatment is finished. The addition of radiation therapy after surgery and chemotherapy improves outcomes for pleural mesothelioma patients in some studies. Targeted therapy. Targeted therapies are newer systemic therapies that interfere with specific molecules involved in cancer development or growth. One targeted drug approved for pleural mesothelioma is the angiogenesis inhibitor bevacizumab, Avastin. Bevacizumab works by blocking new blood vessel growth that tumors need to thrive and spread. It is generally combined with chemotherapy for treating pleural mesothelioma. Other novel targeted therapies being studied for mesothelioma include inhibitors of the epidermal growth factor receptor, EGFR, platelet-derived growth factor receptor, PDGFR, vascular endothelial growth factor, VEGF, and hedgehog pathways. Side effects depend on the specific targeted drug but tend to be milder than chemotherapy. The goal of targeted therapies is to more precisely attack cancer cells while minimizing toxicity to normal cells. Multimodality therapy. Based on research evidence, multimodality therapy, using a combination of surgery, chemotherapy, and radiation in a coordinated treatment plan, offers the best chance for long-term survival with pleural mesothelioma. A common approach is either EPP surgery or pleurectomy, decortication surgery followed by chemotherapy with a platinum, methotrexate combo and then radiation therapy to the chest in some cases. Getting treated at a high-volume mesothelioma center by a multidisciplinary team experienced in delivering multimodality care leads to better outcomes. Coordinating treatments and managing side effects as a team ensures the different modalities are optimally combined for maximum effect against the cancer. The average survival rate with multimodality therapy can reach 20 months or more. Palliative care. Palliative care focuses on symptom relief and improving quality of life for patients with serious illnesses like advanced stage mesothelioma. It concentrates on controlling pain, shortness of breath, fatigue, and other physical and emotional issues related to the cancer or its treatment. Palliative care therapies for pleural mesothelioma may include supplemental oxygen, pain medicine, dietary changes, respiratory therapies, drainage of fluid buildups in the chest or abdomen, nutritional support, counseling, and other supportive measures. The goal is to optimize comfort and coping every step of the patient's journey, whether they choose further anti-cancer treatment or choose to focus on comfort. Palliative care works hand in hand with oncology care to ensure all medical, psychological, and spiritual needs are addressed for both patients and their loved ones. Pleurodesis. Pleurodesis is a technique to help prevent more fluid buildup around the lungs for pleural mesothelioma patients whose tumors have caused pleural effusions. It involves using medication or surgery to induce inflammation and scarring that fuses the two pleural surfaces together so fluid cannot accumulate again in the chest cavity. Common pleurodesis methods include delivering a chemical irritant like talc or bleomycin via chest tube, installing a sclerosing drug, or having a surgery called thoracoscopic pleurodesis to ablate the pleural surfaces under direct vision. The goal is to reduce the need for repeated drainage procedures and improve quality of life by alleviating pressure and breathing problems from recurrent fluid pockets. Success rates for pleurodesis average around 70 to 80% depending on the technique and size of the effusion. This covers the most common treatment approaches used for patients with pleural mesothelioma, including surgery, chemotherapy, radiation therapy, targeted therapy, multimodality therapy, palliative care, and pleurodesis. As mesothelioma remains a challenging cancer to treat, selecting the best individualized therapy plan requires input from an experienced mesothelioma care team familiar with all the treatment strategies and latest research developments. The goal overall is improving survival time, symptoms, and quality of life throughout the treatment journey. If all goes well, some patients can now achieve extended remission or possibly even a cure with aggressive combined modalities.